evening, and here we are beginning a new week together. The number of cases of coronavirus growing quickly in this country. The urgent pleas for help from the front lines tonight. And the U.S. Surgeon General, who declared today, this week, it's going to get bad. We will carefully guide you through it all again tonight. And the news that broke just before we came on the air tonight, the governor of the state of Florida now asking passengers flying in from New York and New Jersey to self-quarantine for 14 days. In the U.S., more than 42,000 people sick and more than 500 dead. And the graph now showing how sharply those numbers are rising. And by last count, it's been changing by the hour. At least 17 states have now imposed those tight restrictions, closing businesses, telling people to work from home, essentially to shelter in place at home. And look at this tonight, images of the empty streets across this country, now at a standstill, gripped by the seriousness of this virus. New York, Chicago, New Orleans among those images. An empty terminal at the Detroit Metro Airport. And tonight, a major disaster now declared in 3 states, New York, California, and Washington State. FEMA constructing temporary hospitals, this one at the Javits Convention Center here in New York. And the Navy hospital ship Mercy left the port of San Diego on its way to Los Angeles, a second ship soon leaving for New York City. Testing still difficult to get. The long lines, and this is just one snapshot from Miami Gardens, Florida tonight. The wait for results could take days. And we took note of this tonight, the line of cars, and this is not a testing site, but a food pantry in Dayton, Ohio. The National Guard helping to distribute food, so many families suddenly out of work. So tonight, what's being done to help them? And that tweet from President Trump about the administration's 15 days of social distancing, the tweet saying, "We cannot let the cure be worse than the problem itself," at the end of the 15-day period. So what was the president suggesting? ABC's Chief National Affairs Correspondent Tom Llamas leading us off tonight.
Tonight, the battlefield in the war on the coronavirus expanding. New York's Javits Center, the city's convention facility, now being turned into a hospital. Hospital beds and ventilators being delivered, the National Guard on site. The goal here, to house 1,000 patients. Governor Andrew Cuomo ordering all hospitals to increase capacity by 50%. There are more than 20,000 people infected with coronavirus in New York.
This is going to get much worse before it gets better.
The Pentagon also readying 10 field hospitals capable of holding a total of 1,550 beds. At least 2 of them will arrive within 72 hours to Seattle and New York. And the situation in New York worrying other states. The governor of Florida taking a drastic measure, issuing an executive order mandating anyone flying in from New York or New Jersey to do a mandatory self-isolation for 14 days.
Hopefully that will be a deterrent for people if you're just simply trying to escape here to avoid the restrictions that have been put in place in your own state. That is probably not a good idea.
New York City now the epicenter of the pandemic in the U.S. Cuomo announcing his state will move forward with trials for a new drug therapy, the same one pushed by President Trump. 10,000 doses of the anti-malaria drug hydroxychloroquine coupled with Zithromax, also known as a Z-Pack. Its effectiveness still unproven.
Hydroxychloroquine and the Z-Pack, I think, is a combination probably is looking very, very good, and it's going to be distributed.
And treating those sick people is leading to a shortage of supplies in some cases.
We're short on PPE that a lot of folks are short on around the country. Masks, face shields.
We're filling up our ICUs. We have several floors now that are devoted only to COVID positive patients.
The chief of surgery at Columbia University warning in a memo to staff that the hospital is burning through 40,000 masks every day when on a normal day they use 4,000. Cornelia Griggs is a mother of 2. She's a pediatric surgeon at that same hospital.
We're running into potentially crisis situations, having to make the split-second decision. Am I going to run into this room to save this patient, or am I going to take the time to try and scramble and find a mask?
Governors calling on the federal government to push manufacturers to make needed supplies, something the president said days ago he was prepared to do.
They legally have a tool called the Federal Defense Production Act. Use it.
Across the country, companies big and small doing what they can to help.
These are our medical gowns that we've been making here at Coleman Knitting Mills.
Coleman Knitting Mills in Utah is taking fabric from cheerleading uniforms to make gowns and masks for a nursing home group in Washington State. And testing for coronavirus still a problem in so many parts of the country. In New Jersey, some drivers turned away from a new drive-through testing facility before it even opened this morning. In Miami, long lines at a new testing site at Hard Rock Stadium, where the Miami Dolphins play. There, the National Guard was giving tests to people 65 and older showing symptoms. A growing number of states now ordering residents to stay home. But overnight, the president signaling he's getting impatient, tweeting, "We cannot let the cure be worse than the problem itself. At the end of the 15-day period, we will make a decision as to which way we want to go." Late today, the president doubled down.
America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months that somebody was suggesting.
President Trump just moments ago. Tom Llamas with us live tonight from the Javits Center here in New York City. And Tom, I know New York is bracing for a very long fight. It's going to take at least a week for that field hospital to be up and running.
That's right, David. A week to 10 days. This is one of 4 facilities around the state that will deal with the overflow of patients. Now, David, at first, this will house patients that don't have COVID-19. But if things get very dire, facilities just like this one could eventually house those patients.
And Tom, while I have you, the vice president also made news today when he acknowledged that he's asked governors to reach out to anesthesiologists about devices that could possibly be converted, would help with this shortage of ventilators in this country.
That's right, David. It was an interesting headline. The vice president did this at FEMA headquarters today in Washington, D.C. He basically called on the governors to speak with their anesthesiologists in their states. There's a device, he says, according to the vice president, they can convert to a ventilator, and there's tens of thousands of them right now in the public. David?
The urgent effort to get those supplies tonight. Tom Llamas leading us off. Tom, thank you. And tonight also dire warnings from authorities after so many of those images over the weekend. Too many people gathering in public places. Here are just a few of them. From Brooklyn's Prospect Park to California's Venice Beach to the marinas of Miami, Florida. Images that made millions of Americans angry, asking why are so many people ignoring the warnings? They're putting others at risk. Here's ABC's Kaylee Hartung tonight, and we should note that she's now back to reporting after recovering from the coronavirus herself. And tonight here, she describes what her symptoms were.
Tonight, law enforcement threatening to crack down on people ignoring the warnings to stay apart.
If you and your friends decide to throw a party at your home and you invite 20 of your closest friends, stop. Law enforcement officers will have to break that party up, and there will be criminal consequences.
From coast to coast, stunning images of large groups. In New York, crowds walking near the Hudson River. And in Los Angeles, beaches packed with people.
There are not enough people out there who are taking this seriously. I want America to understand this week it's going to get bad.
The virus hitting America's youth. In New York City, 46% of the cases in people 18 to 44. Nationwide, nearly half those flooding ICUs are 20 to 64.
Woke up in the middle of the night and had a lot of nausea.
26-year-old Fiona Lowenstein was diagnosed with COVID-19, hospitalized, and put on oxygen.
So I definitely did not think that if I got hit with this, I would end up in the hospital.
Dr. Anthony Fauci saying so far it's a mystery why it's impacting the young here, emphasizing the danger.
We know that underlying conditions, all bets are off, no matter how young you are.
The virus even sickening infants. 7-month-old Emmett getting 103-degree fever. His mother, Courtney, trying to make sure it doesn't spread to her other children.
Keep your babies at home, wash your hands. You know, it's hard to keep their little hands out of their mouths.
While many are struggling in hospitals, roughly 100,000 worldwide have recovered. After returning home from covering the initial deadly wave in Washington state nursing homes, I felt symptoms.
These aches all over my body. Right now, I'm trying to figure out how to get tested, and it's unbelievably hard.
I tested positive. I'm still isolating after recovering.
Over the next 4 days, I got really bad.
Clay Bentley spent 11 days in the hospital, had a fever, and could barely breathe. This is him today.
Guys, I'm still at it, still going strong.
He got through it, and we really loved seeing that today. And Kaylee, we love seeing you back on the air tonight. I know you're still in self-quarantine, but because people are so curious around this country and nervous about what these symptoms will be, and rightly so, how did you know that you were sick, and how quickly did it come on? How quickly did you begin to get to the other side of this?
Well, David, it was 12 days ago that I first had a runny nose and some body aches that were manageable. I dismissed those symptoms. The very next morning, as soon as I woke up, I knew something was wrong. I had a headache that just wouldn't go away. Those body aches had increased to pain all over, particularly in my lower back. I had chills and a low-grade fever that spiked for a very short time. Even the next day, though, I was starting to feel better. Fatigue and congestion lingered the longest, but I'm so glad to report that I am feeling well now, and it's been about 4 days of that.